The Taoiseach speaks about responsibility. I think there's only one responsibility that's at issue here, and that is the responsibility to the patients, to the people who went into Tallaght Hospital to have an X-ray taken. Now, as the Taoiseach says, there were something like 700,000 plus X-rays done over that period of time. I imagine that pretty well every one of those is worried about whether or not their X-ray was one of these 58,000 that wasn't looked at by a radiologist. So I think the first priority is there are still 23,000 X-rays, as I understand it, that have not yet been reviewed. The first priority is to get those reviewed as quickly as possible, and I want the Taoiseach to tell me how quickly that is going to be done. Secondly, I think the patients concerned, the people concerned who went in for X-rays, need to be told, were there X-rays included in this in these 58,000 that weren't looked at, and need to be given the all clear if they're to be given the all clear, or told that there's a problem if there's a problem, and that needs to be done as a matter of urgency. You see, the Taoiseach says that this came to light in early 2009. And there's other information that it was coming to light in 2008. We are told that there were GPs making inquiries about this as far back as last summer. Yet it would appear that nothing was done about this until the new chief executive was appointed to the hospital in December, when he found out about it. And by the sounds of it, listening to his interview this morning, it would appear that presumably somebody told him, we've got a big problem here with X-rays that haven't been looked at by radiologists. And he took some action to deal with it. So I think the first issue that arises here is, what happened between the time that somebody in that hospital found out that this was the practice and the new chief executive? Why wasn't it dealt with until the new chief executive was appointed? That's the first question. The second question is this. The new chief executive says that he told the Minister for Health in December of last year, and she says this morning that really she didn't know the scale of it until yesterday. Now, I find that just unbelievable. I mean, after, we had Portlaoise, we had Cork University Hospital, we had Ennis, we've had a number of HICWA reports. I mean, we've had a sequence of issues that have arisen over time, where there were misdiagnoses, where tests weren't followed through, where the right people didn't look at the file, and so on. And, I can't understand why, if the chief executive of Tallaght Hospital tells the Minister for Health that there's a big problem here with X-rays, that she didn't even inquire as to the extent of it, or that she didn't even make an inquiry, for example, in British Houston's article this morning, where he makes the point, he says, if such a significant failure can occur in one of the state's premier teaching hospitals and not be addressed for over 4 years, it may well have happened in other hospitals also. You would imagine that if the Minister for Health is told in December by the new chief executive of Tallaght Hospital that there's a big problem with X-rays, that she didn't apparently, by the sounds of it, even inquire as to how many, how big, what needed to be done about the problem, how could she and her department or the HSE help in resolving it. None of that appears to have been done, and she tells us that yesterday was the first that she found out about the full scale of it. That coming after all that we had heard before is just incredible. And secondly, I find it difficult to understand why it wouldn't have dawned on her that if there was a problem of that size in Tallaght, might there be a problem somewhere else? And might it require some investigation or some inquiry across the health service as to whether there were other X-rays that weren't being looked at? Taoiseach, there is in Tallaght a medical problem and there is a human problem for the people who are involved, which needs to be addressed urgently, and I would urge that that be done. But Taoiseach, there's also a political problem. We've had enough now. I think this country has had enough of the mismanagement of the health service, this sequence of things going wrong in the health service and nothing being done about it, not when it is discovered, but when it becomes public. We didn't have anything done about we're not hearing about inquiries and investigations and what went wrong and so on, and it's the same pattern all of the time. It's only when it comes out in the public domain and it becomes a public issue that there's a big flurry of activity. One question for you, Taoiseach. You're reshuffling your cabinet. Are you going to appoint a new Minister for Health? The Taoiseach talks about the level of risk, and he seeks to give reassurance that that's low. The truth is, Taoiseach, you don't know what the level of risk is here. There are 14,000 people, patients, who had a total of 23,000 x-rays carried out at Tallaght Hospital, some stage over the last 4 years, which weren't looked at by a radiologist, and those x-rays have not been reviewed yet. So you don't know. And I ask you again, because I think this is the first priority, how quickly are those x-rays going to be reviewed and those people be put in the clear, if hopefully that is the situation? That's the first priority, and I think we need to have some information, and somebody, if you're not in a position to tell us now at Leaders' Questions, and the Minister for Health is in New Zealand, then somebody from the government needs to come in here today and tell us what is the story and how quickly are those 14,000 going to be dealt with. Secondly, I need to hear, and you didn't answer it, when are the patients going to be told? They haven't been told. To the best of my knowledge, none of the patients involved have yet been told that they were involved in this, and you know what the situation is with their X-ray, and so that they have full information. Thirdly, you didn't answer the question as to what happened between this first came to light and when the new chief executive found out about it. I mean, it would appear nothing was done from the time it first came to light to the appointment of the new chief executive. And I think we need some explanation as to why that was the case. Fourthly, you haven't answered the question as to why the Minister for Health didn't appear to take it terribly seriously when she was told about it. I mean, she didn't. She tells us on radio this morning that she didn't know the full extent of it until yesterday, and relied on that there were protocols and so on. I can't understand that, Taoiseach. I cannot understand that if the Minister for Health was told by new Chief Executive of a hospital that there's a problem here, and she's told it at a time when there has been a sequence of issues, public issues, and she's been in and out of this House and involved in public controversy about misdiagnoses and problems associated with tests not being looked at and so on, that, you know, that she didn't go on alert when she was told this. And I want to know, what did she do about it between the time that she was told about it in December and the time that it has come into the public domain? And finally, Taoiseach, finally, are you going to leave Minister Harney in the Ministry of Health, or are you going to replace her? You are apparently considering a reshuffle of your cabinet. For quite some time, and my own party quite some time ago tabled a motion of no confidence in the Minister for Health arising from some of these earlier incidents. I have a lot of time for her. She's been a very competent minister in other areas, but she has been a hopeless Minister for Health. And I think that it is time that she was moved. And I want you to tell people, because this I think is the issue. And when I'm talking with people about the state of the health service, one of the questions that comes up repeatedly is, how long are you going to leave Minister Harney in charge of the health service? And you're about to reshuffle your cabinet, and you have an opportunity of telling the people of this country this morning whether or not you are going to appoint a new Minister for Health next week or the week after St. Patrick's Day, or whenever it is you're going to come in here and announce a reshuffle.